Hospitals, how are we doing? We are very, very busy. The number of COVID patients in our hospital is the highest it's ever been. It's greater than what the peak was last January, probably by about 15 to 20% higher. There's been a lot out there about a lot of it misinformation, some of it true, and I'm going to try to explain about people in the hospital with COVID. So the majority of people who are getting hospitalized with COVID are there because of COVID. It's COVID that put them in, well over half. But yes, there are some people in the hospital where COVID is a contributing, but maybe not necessarily a primary reason. Those numbers are lower, probably about maybe 20 to 30%. But think about it, it's not always quite as easy as simple as what social media tries to make it out. So if you have somebody admitted and they've had a stroke and they also have COVID, how is COVID contributing to that? It probably is. We in medicine who admit people with acute serious medical problems understand that there's oftentimes an incident, many times an infection that tips a person over the edge. And that could be influenza, that could be another virus, it could be a bacterial infection. In the instance now, it could be COVID. And it's enough to take somebody and who's been doing all right and tip them over, and then they have an acute medical problem. And so, it does contribute. But you also have to be aware that, when you have 10 to 15% of a community, such as Forsyth County or Winston-Salem or Charlotte, that has COVID at any one time, and that's probably about what it is now. It's roughly around 10 to 15% of people have COVID right now, that if you get admitted for a car accident, you're going to have a 10 to 15% chance of testing positive for COVID, just because that's what the rate is in the community. So yeah, there are some people in the hospital who incidentally just are found to have COVID, and that's not why they're there. That's a minority of people, probably around 10 to 15%. And then roughly about 60% or so are there because of COVID, and that's the real reason that brought them in. And then the others are people where COVID contributed. So you gotta interpret the social media out there that COVID is the reason why our hospitals are so busy. So even if you get admitted for a car accident and you just happen to test positive for COVID, we still have to put you in a special room, in a special area of the hospital. We still have to put on all of our personal protective equipment, and we still have to limit visitors. So it still makes us busy, and it still contributes to the workload. One of the other reasons hospitals are so busy right now is because a lot of our staff are getting COVID. Even though we have vaccine mandates, breakthrough infections occur. When a breakthrough infection occurs, our staff do have to isolate, and some of them have to quarantine if they're exposed. So that cuts down on the number of people that come to work, and that makes it busier.